and welcome to Foot and Ankle Surgical Associates Patient Educational Series. During the next few minutes of this video, we'll be discussing an extremely common condition that many people are afflicted by each year, neuropathy. Neuropathy is the medical term for nerve damage. There are many causes of neuropathy. In our practice, diabetes is the most common cause of neuropathy. As many as 26% of patients who are diagnosed with diabetes already have signs and symptoms of neuropathy. So why does one get neuropathy? The peripheral nerves are susceptible to a variety of toxic, inflammatory, hereditary, and infectious factors that can impair their health and function, leading to the clinical disorder of polyneuropathy. Somewhere along the course of the nerve, these inflammatory markers attack and impair the signal transduction, as well as provide some static in the nerve signaling to the brain. This causes patients to interpret signals sent very differently, or sometimes not at all. In the case of diabetes, it is the high levels of blood sugar that can cause the damage to these nerves. They can also damage the blood vessels feeding the nerves, causing these symptoms and signs of polyneuropathy. So what are the symptoms of neuropathy? The symptoms vary depending on the type of neuropathy present, the extent of the disease, and the perception that an individual has for touch and sensation. The most common symptoms of neuropathy include pain, burning, tingling or numbness in the toes and feet, difficulty sleeping at night, and extreme sensitivity to light touch. The pain may be worse at rest and improve with activities such as walking. Some people initially have intensely painful feet, while others have few or no symptoms at all. So then what can be done to help alleviate the symptoms of neuropathy? The first step in treating neuropathy is to diagnose the source. At Foot and Ankle Surgical Associates, we utilize nerve conduction studies to help focus in on the cause of your neuropathy. A nerve conduction study is a test that utilizes electrodes placed along the pathway of the nerves of the lower extremity. These electrodes send and receive electrical data along the path of the nerves and help to determine if the nerve is properly sending and receiving signals to the spinal cord. Once it is determined the type of neuropathy that is present and the severity, we at Foot and Ankle Surgical Associates take a systematic treatment approach. The systematic treatment approach consists of modification of lifestyle, combined with essential nutrients, prescription medication, and laser therapy. These all act to bombard the neuropathy and help you find the relief you so desperately deserve. The first step of this systematic treatment approach is lifestyle modification. In the cases of neuropathy associated with diabetes, alcohol use, and vitamin B deficiency, the best way to stop the progression and get a handle on the symptoms is to stop the offending agent. For diabetes, tight blood glucose control is paramount in decreasing the symptoms of neuropathy. For alcohol-induced neuropathy, abstinence from alcohol is necessary. And for vitamin deficiencies, specifically vitamin B, supplementation is required to slow or lessen the symptoms of polyneuropathy. As part of your lifestyle modifications, once you've been diagnosed with polyneuropathy, it's important to realize your ability to feel normal sensations of pain, heat, and friction are decreased. This leaves your feet and legs open to injury and ulceration. Certain steps should be taken to ensure your feet and legs remain healthy. First, avoid activities that can injure the feet. Some activities increase the risk of foot injury and are not recommended, including walking barefoot, using a heating pad or hot water bottle on the feet, and stepping into the bathtub before testing the temperature with your hand. Second, use care when trimming the nails. Trim the toenails along the shape of the toe, rounded, not straight across, and file the nails to remove any sharp edges. Never cut or allow a manicurist to cut the cuticles. Do not pop blisters, try to free ingrown toenails, or otherwise break the skin of your feet. See your podiatrist for even minor procedures. Thirdly, wash and check the feet daily. Use lukewarm water and mild soap to clean the feet. Gently pat the feet dry and apply a moisturizing cream or lotion. Fourth, Check the entire surface of both feet for skin breaks, blisters, swelling, or redness, including between and underneath the toes, where damage may be hidden. Use a mirror or ask a family member or caregiver to help if it's a difficult task for you to see the entire foot. Fifth, choose socks and shoes carefully. Select cotton socks that fit loosely and change the socks every day. Wear shoes that are fit correctly and are not tight, and break new shoes in slowly to prevent blisters. Ask about customized diabetic shoes from your podiatrist if you have any misshapen feet or ulcerations. Specialized shoes can reduce the chances of developing foot ulcers in the future. Shoe inserts may also help cushion the step and decrease pressure on the soles of the feet. The next piece of our systematic approach to treatment of neuropathy is vitamin supplementation and prescription medications. At Foot and Ankle Surgical Associates, we believe that many of the symptoms of neuropathy have something to do with vitamin B deficiency. Supplementation of these vitamins is a key factor to treating the systemic approach of neuropathy. B vitamins provide healthy enzymatic function that allow the nerve cells to obtain energy, as well as provide nutrition to keep the nerve cells healthy. Along with vitamin supplementation, many options for prescription medications are available. When you see your podiatrist at Foot and Ankle Surgical Associates, you'll be able to discuss with him or her what is best for you. The final piece of the systematic approach to treatment of neuropathy is MLS cold laser therapy. As mentioned before, neuropathy occurs when the nerve cell becomes inflamed and inundated with various toxins. Inflammation is a key factor to the onset and progression of neuropathy. MLS cold laser therapy is designed to attack the inflammation, therefore increasing the nerve's ability to obtain the proper nutrients and oxygen they need to be healthy. Modern science has shown that specific wavelengths of laser light have particularly strong healing properties. Cellular tissue repair and pain reduction can occur by focusing laser light on affected body areas. Thank you for taking the time to watch this educational video about neuropathy. If you or anyone you know suffer from this disease of neuropathy, I would encourage you to see your Foot and Ankle Surgical Associate podiatrist. It is through this systematic approach of treatment that we can help you find the relief you deserve.